Okay, hello friends. So far now, I have been requested to go for a video on the pregnancy and COVID-19 for doctors. That how we obstetrician or doctors uh, should consider the thing pregnancy and COVID-19. So right now the pandemic is going on and everyone just very scared about this thing. Even doctors are the main warriors against this COVID-19 pandemic, and especially the obstetrician, uh, considering the pregnancy, delivery, and labor and postnatal care is a very essential services. So we are routinely encountered with this COVID-19 patients in case of pregnancy, labor, delivery, and postnatal care. So I have some guidelines for how we should proceed and how it works according to this thing. So I have just learned two countries guidelines. One is for UK and the second is for India. And I found it that 99% of the guidelines are similar. So at this stage, because there is no such research on COVID-19 and pregnancy and its effect on pregnancy and fetus, so we have almost similar kind of guidelines for everyone. So I take it as a universal guidelines. Okay, so let's start with this thing. So pregnant women, as far as COVID-19 is concerned, is a moderate risk group. So they are not high risk group. Who are the high risk group? The elderly people having some diseases like heart disease, diabetes, immunocompromised patient, children's. They are high risk group. But pregnant women are not high risk for COVID-19. They are moderate risk group. Okay. The very basic thing for COVID-19 pandemic is social distancing, face covering, balanced diet, regular hand washing. It is the backbone of prevention and treatment. What can be the symptoms? So three symptoms are described so far. There are many, but three are considered very common. The first one is fever, high temperature, continuous cough, loss of taste and smell sensation. This kind of symptoms are the highest and most common. Okay. Now what if the patient comes is a corona positive? So you are posted in an emergency obstetric emergency unit and you are getting a pregnant woman who is for labor and delivery, and she is corona positive or COVID-19 positive. What this patient what this patient should do, or any ANC patient, for example 6 week pregnant, 6 month pregnant, 7 month pregnant patients with corona positive test. So again, there is not increment of any risk apart from corona. Okay, as far as pregnancy is concerned, they behave just like as another adult, and only some require hospital treatment. For example, only 10% around patients require hospital treatment. Otherwise they can be managed at home only with the isolation, and only very few require intensive care. So if you are facing with a patient who is a corona positive, then you should know this thing, that they are as same people having risk against COVID-19 and another as compared to the another normal people. Pregnancy is not a thing here. Okay, only some require hospital treatment and a few require intensive care. Okay, so yes, when we our experience with viral diseases in pregnancy, that the viral diseases are used to be a severe infection in case of pregnancy. We know this thing, okay, because pregnancy is a state of immunomodulation. So exactly at present we don't know whether the COVID-19 is get severe, or the symptoms are getting severe when the patient is pregnant. We don't know it yet. But the good thing is that so far, what research we have, what studies we have, there is no increased risk of COVID-19 severity in pregnant patient. Okay, now if some mother gets COVID positive, then what are the risk of transmission to the baby? So another good thing is the risk of transmission is low. Okay, no extra risk to baby due to mom having positive corona test, because when we practice social distancing, when we practice room distancing between mother and neonate, then there is no increased risk to the neonate also, and the vertical transmission is also very very low. That's why this thing is not bothering us right now. Some reports from China, or some studies from around the world, they suggest that corona positive patients have increased chances of abortion. But again, it's not confirmed, just heard on the studies. What decreases the risk is folic acid and vitamin D. Now, I have a chart how to proceed with a pregnant woman with exposure, or if she gets positive. Now, whenever the pregnant patient comes to you that yes, she has a history of exposure, either to a very active cases pockets, or with a confirmed corona positive patients. So what will you do? Apart from the ANC examination, you will do a clinical examination in view of respiratory system, that you will ask for the symptoms, that fever, cough, loss of taste and smell sensations, and you will also perform a test, that is COVID-19 test, that is RT-PCR. Okay, now till you perform that RT-PCR and the report is on the way, if the patient is asymptomatic, that there are no symptoms of corona, then you can do a home isolation and monitoring at home. If 14 days are passed and if the report comes negative, then you can stop monitoring. But if the report comes positive, then you will continue 14 days of home isolation. Breastfeeding, yes, can be done with room separation, that is in the same room the mother and fetus are separated, in a curtain, a physical thing or an engineering thing is there between mother and fetus, so that we can decrease the direct to direct respiratory transmission from mother to fetus. Okay, now if the patient is symptomatic, that is if the fever is more than 38, respiratory symptoms, then you need to monitor the patient into the hospital. Okay, if the report comes negative, then you can again send the patient to home isolation and manage the symptoms there only. Okay, and if symptom does not go away, you will go for retesting. But suppose if the patient's report comes positive and a patient is symptomatic, then you must refer that patient to a tertiary care unit. Okay, now After reaching at the tertiary care unit, the mother's maternal surveillance has been done for corona. So again, CXR, that is chest X-rays, should be done. So far we have heard that yes, when the patient is pregnant, we should not expose the baby for X-rays. But with this wide pandemic and very severe pandemic, the norms has changed. Now you need to do X-rays also in pregnancy, obviously with shielding, but you need to do X-ray. Only then you can just monitor how the COVID-19 infection to lung is proceeding. Okay. Also you measure the vitals and oxygen saturations. For fetal surveillance, you need to do the FSH monitoring, IV antibiotics and steroids at the time of giving the steroid, like 34 weeks. If the patient require ICU admission, that means that if the systolic blood pressure is less than 100, respiratory rate more than 22 and Glasgow Coma scale is less than 15, then the patient requires ICU admission. So in the ICU admission, once a pregnant patient is in the ICU for COVID-19, now what kind of treatment you will provide to that patient? Suppose you got a patient who is a pregnant, and right now she is not in any problem as far as our obstetric work is concerned, but yes, the patient has severe symptoms of COVID-19 and she is admitted in ICU. Now what you do is, if there are very severe symptoms and you actually cannot control those symptoms, then you need to terminate the pregnancy. And this termination of pregnancy, there are no specific rules that whether you should terminate or not, and there are no such guidelines to terminate the pregnancy. But yes, you have to approach a multidisciplinary approach with gynecologists, with respiratory physicians, whether to help the patient, that if she can deliver, or if we terminate the pregnancy, then the chances of improvement in the COVID-19 situation is higher, then yes, you should go for termination of pregnancy. Okay. So if you find a patient which is less than 24 weeks of age, 24 weeks of gestation, and she has a very COVID-19 severe symptoms and she is admitted in ICU, you will go for MTP. Okay. And if after 24 hours is there, 24 weeks is there, you will go for vaginal delivery, induction of labor, early cord clamping, the test of the neonate, breastfeeding, everything. But for sake of patient, we need to terminate the pregnancy if very severe symptoms are there. Sometimes we need to prefer a cesarean delivery in case of septic shock, acute organ failure and fetal distress. Now this was the algorithm for management. Now what we should do for the patient comes to ANC care. Now what to do with the ANC care? Now you need to decrease the visit of the patient for ANC visits. So the minimum 4 visits should be done at 12 weeks, 20 weeks, 28 weeks and 36 weeks. If some patient, while comes ANC patient comes corona positive and she is asymptomatic, then you can defer the visit by 7 days even. And mother is advised for kick count. Fetal growth surveillance is done by USGs. Now, intrapartum care, when the patient comes to you in a labor, then you should refer that patient due to its COVID positivity to higher center, that is tertiary center. Frequent vital monitoring and oxygen monitoring hourly. If the patient comes to labor, then the oxygen saturation should be maintained, continuous CTG should be done. Now, being positive for corona does not change the mode of delivery, whether you go for cesarean section or normal delivery. No, it does not change. If the patient is hypoxic and you feel that terminating a pregnancy early will be helping to the mother with consultation of respiratory guy or respiratory clinician, you can go for cesarean section. What about postnatal care? Postnatal care, you have a room separation. This is a very new idea of room separation. Earlier it was like rooming in thing, but now due to this very unique pandemic, we are going for room separation, in which one room with a good amount of aeration, the mother and fetus are kept but separate. A curtain or engineering barrier should be there, and at least 6 feet difference should be there. Breastfeeding will continue, because not doing breastfeeding will invite more problems for the baby than the corona or COVID-19 itself. So this was the very basic criteria as far as COVID-19 and pregnancy is concerned. But again, this guideline keeps changing. You need to be very, very updated to the health authority where you are situated, and act according to that. Again, COVID-19, if we take enough precautions, we can prevent it actually, and we can prevent ourselves also from the patients. So, and yes, servicing the pregnant woman is a very noble cause, and as an obstetrician, you should actually come forward for service rather than just avoiding those patients, because they are in very dire situation. They need help. So I think you should help also. Thank you.